My name is John Provan. I've been a builder since 1981. The whole of my life I've been interested in property and building. Started off in banking, so I guess my whole life revolves around investing and property. I had the same interest as my father, his father before and his father before, so it's handed down through the generations to the sons. I worked with my father and his brother for 8 years with my brothers, and we then went out on our own in 1981 and formed our own building company, which we were together for some 25 years. I have 2 daughters, one granddaughter and one grandson. I guess in the early days we've always done all of our insurances, property insurance through an insurance broker, and then we were recommended to an advisor because obviously being a self-employed small business owner, you need to protect your income if something goes wrong, particularly if you're investing in property and you have considerable debts. You don't want to leave a burden to your family. So I, in the early days, took out a policy to cover myself for death and trauma. Semi-retired, I was diagnosed with prostate cancer. I wasn't sick, but I had the normal type of symptoms that you get with prostate cancer. My doctor suggested that with a rise in my PSA, which wasn't considerable, but together with the other symptoms, I go to a specialist and have some tests. I've recently had a friend who had throat cancer, and I was thinking about him and I thought, look, I want to know straight away. So I rang my doctor back and said, refer me to a specialist. I guess when I went to see the specialist, I sort of faced that, I thought in myself, even though I wasn't sick, I thought I have got prostate cancer. I just had that feeling. And when I went back to see the urologist, of course, it was still quite a shock when he said that I'd had a cancerous tumour in my prostate. I had the options of radical surgery or robotic surgery or either treatment of radiation. So at my age, if I did have the radiation and it came back, there was no guarantee that radiation would then cure me. So I simply said to him, what would you recommend? And he recommended the robotic surgery to remove my prostate completely. After recovering from the initial shock of being told that I had prostate cancer, I tried to locate my policy, which I eventually found a copy of, and I read it right through, and a few of the definitions I wasn't sure whether I was covered for prostate cancer. So I then contacted my advisor Phil, and he knew anyway that I was covered by the policy. So that gave me a lot of relief in knowing that I could then I wouldn't have any financial pressures and I could concentrate on my treatment and recovery without that worry. I lodged the claim through Phil, provided all the necessary documents, and it was settled promptly and professionally within 4 weeks. And that was prior to my surgery, which I was very happy about because I didn't want to go into surgery knowing that whether the claim would be paid or not. With the experience that I've gone through, and I hoped I would never use my policy, or that I might eventually, the death portion would be used. For a self-employed person, I would thoroughly recommend that everyone should have a trauma policy.